Welcome to Work Effectively with People with a Disability, Session 3, Communication with People with Intellectual Impairment. In this PowerPoint screencast, we'll be looking specifically at the communication needs of people with an intellectual impairment. People with intellectual disabilities generally experience a degree of difficulty with either receptive or expressive communication or both. That is, with being able to understand information and with being understood. So there are strategies that we can use as workers to minimize any miscommunication and to help our clients to communicate clearly and for there to be a positive exchange. So in terms of communication, what needs to underpin effective communication with a person who has intellectual impairment is our attitude. At all times we need to build rapport and connect with people using warmth and empathy, and a genuine connection needs to be sought, which requires a level of patience and a genuine desire to understand and to be understood with a person who has intellectual impairment. So at all times we need to convey respect for the person through our verbal, non-verbal language and address the person directly and use an appropriate tone of voice that's consistent with their age. So, for example, it would never be appropriate to speak to an adult who has an intellectual impairment as if they were a child. We don't raise our voice, we don't use childlike language, we just speak perhaps with a really clear tone of voice, and we use pacing as a skill. So rather than rush through the information, you would take your time to actually pace the delivery of your information. Irrespective of communication challenges, people have a right to the same courtesy that any other person can expect, that we expect. Some people who have communication difficulties may bring a family member or support worker or advocate to an appointment with you, and that's always okay because it's about empowering through choice, and your client's comfort, psychological safety is always paramount. So if that's helpful to your client, that's fine. But it's really important to remember that you need to address your client at all times. And before you actually speak with the person who's accompanied them to the appointment about your client, they're in the room, then it's a respectful process to check in with your client and to get their consent to speak to that person. So your client at all times must feel that they're your primary focus in the appointment or consult. People with an intellectual disability may have difficulty understanding language that's complex and that contains abstract concepts and lots of technical jargon. So when we're looking at receptive communication, that is the ability to understand what you're saying, it's important when talking with someone with an intellectual disability to speak slowly, so that's where your pacing comes into play, and to leave sufficient pauses so that the person or your client can process some of the words and language that you're using. Speak directly to the person concerned because they're the central place in the communication. Speak in clear, short sentences using simple words. Avoid any long, complex sentences, technical words, or jargon. It's a good idea to ask one question at a time and to provide adequate time for the person to process the question and then to be able to formulate and communicate their response back to you. If the person uses a communication device, ensure that they actually have access to it. It might be helpful for you to get a sense of how the device works, so you might want to read the directions so that you can use it along with them. If it's necessary to obtain part or all of the history from the carer, then just ensure that your process is really respectful. Like you can still maintain eye contact with your client. You can convey attending to them via your body language and touch whilst you're having a conversation with their carer. At times when I'm sitting with a carer, usually it's a parent and their child who has an intellectual disability, I'll always just check in. So an example, I've recently worked with a young man called Sam and his mum, and Sam is 17, and we were working on sexual sort of behaviors and putting some boundaries around sexuality. And so in that, Mum was conveying a lot of information to me, but I made sure that I was continually checking in with Sam, allowing him to input at any stage. So Sam actually functions at probably a 5 or 6 year old level in terms of his communication and cognitive thinking. So whenever Mum would say, you know, I'm worried about what Sam is doing, I'd say, Sam, is that something that worries you? Did you know that Mum was worried about this? And it was giving Sam the opportunity to actually input into the conversation, which he did. He would nod or smile at me because he was kind of, we knew that he knew it was a worry for Mum. So let's look at expressive communication. People with intellectual disability or impairment have trouble expressing concerns, sometimes symptoms, thoughts or feelings, as their cognitive impairment makes identifying, understanding and verbalizing these difficult at times. So some people may also have a coexisting physical condition that impacts their speech. So it's really important to keep the following points in mind. You need to provide plenty of time for the person to respond and formulate their questions or information to you. So this requires being able to sit, to genuinely seek to understand, and to use pacing, so that you're giving that pause time and you're actually being guided by the pace that your client sets. Ask your client to show you how they say yes or no, if it's unclear, obviously, and ask yes or no questions to clarify what they're saying. That might be more appropriate than asking open questions, you know, where you're needing full explanations of something, because that might become very difficult. Ask if they have a communication aid that could help you understand, and if so, ask if you could use it together to help you better understand. Using visual cues like objects, pictures or diagrams to clarify meaning, observe facial expressions, body language for further clues, ask questions to clarify what they're concerned about or are asking. So a case example that I can offer is I've been working with a client, Michael, for the last 2 years, and Michael was diagnosed with Parkinson's about 10 years ago, and only in the last 2 years he's had a secondary diagnosis of Alzheimer's. Michael is in his early 50s, and he's been coming to see me around depression and feeling anxious about all the losses associated with his illness, with the Parkinson's and Alzheimer's. The Alzheimer's, in terms of his memory recall, is okay. He's still able to recall family and context and situations, but his language recall is starting to break down. So in our conversations, Michael needs lots of time to be able to formulate his sentences, and sometimes he'll be talking to me and immersed in a story and suddenly it's gone, and that causes him a lot of distress, because Michael was in the corporate sector. He was a very successful businessman for a long time, And so he was a very, very articulate and effective communicator before his Parkinson's and Alzheimer's. So in terms of responding empathically, I'll often cue Michael when he's lost his train of thought. I'll often cue him around what we were talking, and it almost helps to trigger the memory. So what that means is that I really need to be engaged in our conversation, and that I need to be actively listening the whole time. Also, what we achieve in 1 hour of a session is less in terms of the depth of conversation or the length of our conversations than perhaps I have with other clients who don't have cognitive impairments. So I also tend to draw sort of pictures. Michael is also a great artist, so that's something. He's lost some use of his hand because of tremors associated with the Parkinson's. He's still able to hold a pencil, and sometimes when an idea is just not coming out in words, he'll draw a picture for me. So it's almost like we have a bit of a joke that he actually created. He said that he loves coming to see me to play Pictionary, which is a board game, and that's and it's been a very rewarding experience working with him, despite the challenges that we both experience around the expressive and receptive communication. So just some tips on when you can't understand a client because of the significant sort of barriers to communication. Look, there will be times when this occurs, and in this situation, it's just helpful to ask the person to repeat themselves. So, for example, with Michael, I'll often say to him, look, I think I'm understanding, but can you just say that again for me? And he's incredibly gracious and does that. Sometimes I encourage Michael to say things in another way, so to use different words, and like I suggested, we play Pictionary together, so he'll draw out some ideas. You could ask someone else to accompany your client to their sessions, and at times I have had joint sessions with Michael and his wife. I try to avoid that because I find that being his carer and wife, she tends to speak for him a lot, and so in those sessions Michael contributes less, whereas when I trust that we're going to have a good conversation, albeit with some challenges, we have a great connection around that conversation. So sometimes it's beneficial to have that additional person, always with the client's consent, of course, but there's also benefit to not having them. And if you still don't understand what your client is sharing with you, then it's just respectful to acknowledge that. Like, never pretend to understand by just nodding, going, aha, aha. It's really important to respectfully say, I'm not understanding you. Perhaps today we're having a bit of a tricky day in you being able to get your mouth around the words or to verbalize. Do you have other suggestions? How would you like to use our time? And I think that's a far more genuine response than sitting there going, yep, yep, and not really understanding anything the client's saying. This really would devalue communication and I think is very dishonoring and disrespectful. So something to keep in mind. So looking lastly at how do we work with carers, it's really, really important to see carers and support people as an asset in supporting your clients directly. Always, your client is the person with a disability, and so you need to obtain their consent to work with other people on their behalf or collaboratively together. Family members usually have a high level of expertise on the disability that their loved one has, but also their person's history and personality and functions, and they can be incredibly valuable source of information to be able to support your clients, particularly when you're trying to assess their needs. Workers need to respect the contribution of carers, and not assume that they have all this medical knowledge as well. Management recommendations should be carefully discussed and stated and written down clearly to ensure accurate communication with all is involved. So whenever there's information sharing, it's a really good idea to document in your client's file, in your case notes. Regular revision needs to be arranged to monitor whether the recommendations made for the client are going well or not. And so the client, of course, is the best person to tell you whether their case plan is working or not, but carers are direct witnesses to their story and their lives, and so they can also inform whether the decisions made in case management for your client are working or not, and this allows for the opportunity to alter those case plans. So working very collaboratively is really important, and that goes across to your professional relationships as well. When you think about a client who has a disability, they're actually placed almost in a center of a web, and there are connections to all these other stakeholders and key systems. You know, family is a key system. Then you've got disability services. Then you might have, say they have low vision. They might be connected in with Vision Australia, and they might be seeing a psychologist there or a therapist there around their vision. Then there might be a connection with their optometrist or ophthalmologist. So you need to be able to work collaboratively with all of the colleagues in that allied health team or that care team that supports and responds to your client. So that brings this PowerPoint to a close. I hope that you have found it helpful in terms of just understanding some strategies that can be used when supporting people with an intellectual impairment or disability around communication challenges. Thanks so much for listening.